In New York City, dramatic increase over the past 8 years. That really tells a lot just by looking at that.
Yeah, I mean, just like in the rest of the country, we are in the middle of a huge public health crisis. We're seeing overdose deaths rise among all communities, all throughout the city. And it's really something that we have to take a public health stance on, and intervention, really focusing on how do we get New Yorkers the resources that they need to
Is it
be
being
healthy.
taken seriously enough, or do people who haven't been exposed to this directly in their lives dismiss it as, well, that's somebody else's problem? I'm not on drugs.
You know, I think we are taking it seriously. I think the New York City Department of Health has really been putting a lot of emphasis on the kind of public education campaigns that are being put forward. I think the de Blasio administration has put forward initiatives. You know, we still push back on the amount of money that they give NYPD. We think that this is squarely a health issue, and that actually the Department of Health should be leading every faction of this issue.
Got another chart that I want to show, which is specifically on fentanyl. And again, you look back just 4 years, much lower numbers than now. Is fentanyl in particular something that needs extra attention?
Fentanyl has changed the dynamics of this public health crisis. It is more powerful, and it makes it harder to save lives because it's more fast acting than heroin itself. And so what we have consistently said is that with fentanyl being in the picture, we need to take more aggressive public health interventions like the overdose prevention centers that advocates have been fighting for. It completely gets us to a place where it's like, if we do not focus on getting people access to things like methadone, buprenorphine, places like safer consumption spaces, or what New York City is calling overdose prevention centers, we're going to lose a lot more people.
Your march starts at 10:30 today.
Our march starts at 10:30 today, and it is actually the second time we've done a funeral procession throughout New York City. And we are excited because we have so many advocates coming forward, and it's also a moment of showing strength. We're honoring the people that we've lost unnecessarily, and we're really saying that we actually know what to do, and people that use drugs deserve to tell us what they need, and keeping our families together. And also, just as the Trump administration ramps up their law enforcement interventions around this crisis, we're letting them know that advocates are going to courageously fight for the lives and dignity of our loved ones.
You got a busy day ahead. Yes. I'm going to let you move on. Thank you for starting your busy day with us.
Have a great day.
Good to have you here, Cassandra. Thank you. 6:35.